emphasis will be on Chapter 8, Medical Communications and Documentation. So we'll be looking at oral communication and written communication. We'll continue with Chapter 7, Patient Assessment, and everything we've learned from Chapter 20 with treatment of musculoskeletal injuries too. So the objectives are going to focus on the idea of patient privacy and how that works with types of medical communication. When we're working with verbal communication, this acronym SAILOR is very important and efficient, and then when we hand off to someone else in the patient care chain, we can talk about field care notes. With written communications, we're going to have a patient care report or an incident report form and how to correct that and how to finally paint the parts of a clinical picture. Some key terms are what we just saw previously, distinguishing between an incident report form and a patient care report. On the front end of that, as we immediately rescue a patient, field care notes and the handoff report we might make, so pay attention to those. Now, as a chapter overview, just understand you're going to be evaluating patients with a range of injuries. However, every time you go to rescue a patient, it is important to communicate both verbally and in written form your findings and the treatment that you provided to that particular patient. During handoff of a patient, in particular one that's critically ill, you have to tell the next pre-hospital provider, the EMT or paramedic on the ambulance, say, what you've gathered in terms of information, the care that you rendered, and then most importantly, the patient's response to the treatment that you've provided. It's important for all medical professionals to use the same language around a patient condition, and so that's why we'll spend some time talking about medical vocabulary. In summary, communication and proper documentation of the treatment you provide a patient is an essential skill.